Good morning. We are here with Maurizio Pompili, Professor of Psychiatry and Suicidology at Sapienza University of Rome and Director of the Suicide Prevention Center at Sant'Andrea Hospital in Rome. Good morning, Professor.
Good morning.
And Professor Pompili, in September will be held in Rome an international congress on suicidology. As Chairman of Congress, could you tell us what are the main topics?
Well, we have been organizing this conference for a number of years, and over the past years the interest in suicide prevention increased dramatically both in Italy and throughout Europe and worldwide. And this Congress became a major appointment for people dealing with mental health issues, as well as students and lay people. This year our motto is take a minute, change a life, such as we need to deal with these patients with a dedicated attention, spending more time than the one that we are used to devote to these patients. To change a life, we must understand the psychological pain in each unique individual, and suicide is the result of a dialogue of these individuals with themselves. If we want to change a life, we must understand this inner private dialogue and make sure these people change their view over life and consider other options other than suicide.
So, in the last year, suicide rates have increased worldwide.
Well, not necessarily. We observed a dramatic increase in the United States despite a major investment in suicide prevention. We also observed a reduction of suicide rates in other countries, but nevertheless we must bear in mind that almost 1 million people die annually by suicide in the world. So this is a major public health issue, and as dedicated researchers in the field of suicidology, as psychiatrists, as mental health professionals, we must deal with this issue that is a source of taboo, of stigma, and even when individuals seek help from professionals, they don't necessarily find the proper help that they are looking for.
We'll focus on some of these themes, and there will be many international speakers.
This year, for the first time, we'll have an entire session dedicated to foreign speakers. We'll have opinion leaders in the field of suicide prevention as well as psychiatry. We'll be dealing with cognitive symptoms of depression, the anti-suicidal effect of lithium. We also have a presentation by Professor Rimmer on lithium in the drinking water and the suicide prevention. We'll have also a presentation to a new treatment for schizophrenia, such as the one provided by long-acting injections. So the program is really very rich, is really very full of stimulus, and we are very proud to have these opinion leaders as part of a program. And the following day we'll have an entire day dedicated to presentations by opinion leaders in psychiatry, psychotherapy, psychology, mental health. So we'll have in the Congress more than 40 speakers, including chairpersons and speakers, as it were.
Okay, Professor, many thanks, and see you in September.
Thank you, see you in September, and please come over to us and visit the Congress.